Thank you, Mr. Chairman, and thank you so much to the witnesses. We're all here today because healthcare in America is unaffordable. For families, for farmers, for small businesses. Just 2 weeks ago, I heard it from the Delaware Central Chamber of Commerce. We spent half our meeting talking about healthcare. We've gotten thousands of letters and emails and calls from our constituents, and many who are really concerned about this very present moment and what we're on the precipice of seeing. So as we pursue solutions to lower costs for hardworking families, I want to make sure we continue to hold this up as a priority and a sense of urgency that it is, and also remember some of the things that have gone before us so that we also don't throw out some of the positive things. I thought about the fact that just 15 years ago, a woman could be charged more than a man for health insurance just because of their gender. 15 years ago, those with diabetes or even asthma could be denied coverage or charged more for insurance because of their pre-existing condition. I hear that so much from people. Insurers imposed lifetime limits, as we heard Senator Hassan talk about, on what would pay for essential health benefits, leaving those with costly conditions exposed to significant financial strain. So the ACA changed those things to ensure that millions of people could get access to health care. That doesn't mean that it's perfect. That doesn't mean that we can't make things more affordable in this country. My concern is that some of the proposals, some are really good. I signed on to Senator Marshall's bill right while we were here, the transparency, because that's something I've worked on in the House along with telehealth and PBM reform. But some of what is being proposed might leave patients to fend for themselves in an already complicated and overpriced healthcare system. If doubling or tripling in premiums wasn't bad enough, the Trump administration has also made it easier for insurers to stick patients with more costs when they need care. In June, the administration changed the rules for private insurance that would increase out-of-pocket costs for 160 million Americans, including people who are covered through their employer. This change would amount to a $900 more per year for a family with significant health needs. The rule would also allow ACA plans to raise deductibles while covering fewer services. In other words, pay more for less. Dr. Fegan, this change is currently held up in court, but can you please explain how allowing insurers to raise deductibles and other out-of-pocket costs might impact individuals with chronic conditions?
Senator, I saw patients who would tell me that if, they were worried about the car fare to come for a visit, and that if we scheduled a test for them as well as on the same week as they had a visit, that I should choose between which was more important. So I think that we have a tendency to underestimate how small a charge can be impactful in terms of patients and managing their care. As I said, the study has showed that patients with co-payments as low as 50 cents or $1 made poor choices. Patients will make decisions about not getting screening tests or will not show up for an appointment because they can't afford it this week. It's going to interfere with their rent payment or their groceries. So at county, we saw this on a daily basis.
Thank you. Tomorrow, I'll be introducing a bill to tackle these issues and make it more affordable and make health care accessible. My new bill, the Restoring Patient Protection and Affordability Act, will do 4 things. First, it will prevent health insurance premiums from spiking by extending the ACA tax credits for 3 years. Second, it would eliminate red tape and unnecessary paperwork, making it easier for busy working people who want coverage to enroll. Third, it would force insurance companies to be more transparent about eligibility options. And fourth, it would lower out-of-pocket costs for millions of Americans, including those with employer-based coverage. I urge my colleagues, as we've had discussion here today, and we've talked about different options, I urge my colleagues to look at this legislation. I think the biggest message, if nothing else comes out of this hearing, is that we are 12 days away 12 days away for many Americans of seeing the end of open enrollment and them having to make really difficult decisions and feel the impact. And so the clock is ticking. My time has run out as well, but I hope that we will, as a committee and as a Congress, act on behalf of the American people. Thank you, and I yield back.
Hear, hear.